Mic check. Good morning, good afternoon, good evening. This is Dr. Garais, and this is a recorded tutoring session. I guess you guys didn't get the link, or, hey, I can do this. Now, make sure I'm saving and looking at the right. Good, I'm sharing. So let's look at this. Cardiovascular. These are your goals. Nice to know. Let's see. Compare diagnostic tests, nursing diagnoses. So I don't know what this class is for, but if I'm looking at the objectives, A&P, you should know risk factors, cardiovascular disease, and ways to modify. So if you know your pathology, you know what normal is supposed to look like. You're trying to make it look as normal as possible. And a lot of these risk factors are preventable. So let's look at some of these things. And of course, Department of Nursing are the primary teachers to patients. Instructions, actions of the heart, cardiac cycle, ejection fraction, function of the vascular system. Let's see. You remember that the heart is divided into the systemic and pulmonic. If you recall the box diagram, the left side is colored red. Remember, this is the left side of your patient, and this is the right side of your patient. The left side's colored red, and the right side's colored blue. Red for oxygenation, blue for deoxygenation. Now, it doesn't mean there's no oxygen on the right side. It just means that the right side, the majority of the hemoglobin, will be carrying carbon dioxide. Now, typical 70-kilogram male has anywhere from 5 to 6 liters of blood, right? And you go through the cardiac cycle. That means your entire blood volume in about a minute. Systole versus diastole. Remember, your blood pressure is measured in two numbers. They're actually a ratio of millimeters of mercury. The systolic is the bigger number, and the diastolic is the smaller number, typically. And systole, that is the heart when it's pumping against the greater systemic circulation. But diastole is, you want to think of it as the lower pressure, and that's atrial filling. So if my patient has a blood pressure of 120 over 80, that means their systolic is 120 millimeters of mercury, and the diastolic is 80 millimeters of mercury. All right. Now this pressure is important because, remember, the larger the pressure, the harder it is for the heart to overcome this pressure in order to pump blood around systems. Now, this is a formula, which is cardiac output equals heart rate plus stroke volume. Or is it heart rate times stroke volume? Something like that. So what does that mean? What is the cardiac output? Cardiac output is how much blood is kicking out of your heart per heartbeat and by volume, right? So you can look that up, and it's a formula. I believe it's cardiac output equals heart rate times stroke volume. And stroke volume is the amount of blood per pump of the heart. Ejection fraction is the percentage of blood that is ejected from the heart during systole. Remember, systole, you're pumping against the systemic circulation. Typical ejection fraction is anywhere from 50 to 70%. Ejection fraction, of course, will decrease with heart failure because if you can't pump it, less blood will go out. And that means you have decreased tissue perfusion, meaning to say is you don't have enough oxygen getting to your peripheral tissues. And when when that happens, remember we talked about the definition of shock. Shock in the cardiovascular system doesn't mean that you're scared or you're shocked about something. It is the heart's inability to have a proper ejection fracture so that there's proper tissue perfusion. Okay, decreased ejection fraction, right? Also, if you're not putting out blood, you won't have enough pressure to go back to the heart, because if you recall, the systemic circulation is oxygenated and it's pretty much arterial. So that is high pressure. But when the blood vessels are returning back to the heart, that's your venous, that's your pulmonary circulation, and that's under relatively low pressure. And decreased ejection fraction, decreased pressure going out of your heart, it's going to start causing a backup of blood. And if it starts causing backup of blood in your pulmonary circuit, that is called cor pulmonale, or right-sided heart failure. Increased in pressure to the pulmonary vessels. Another thing that will also back up is the flow of fluid, because if you remember your hydrostatic pressure, fluid in has to equal fluid out. And if you already have decreasing systolic pressures, you're going to have increased pressure of your pulmonary vessels. Then you're going to have an imbalance of fluid, and it can cause pulmonary edema. Here, stroke volume equals the amount of blood ejected from the ventricle during a contraction. That's part of that formula. And cardiac output equals the stroke volume multiplied by the heart rate. I stand corrected. So it's CO equals SV times HR, which is heart rate. This is an important formula right here. Coronary artery system. Now, remember, your coronary arteries are connected to your aorta, and the function of the coronary arteries is to, of course, nourish the heart itself, since the heart is an organ, it's a muscle. And you know that any blockage or infarction of any of these coronary arteries, everything downstream is going to become ischemic. Therefore, that is called a myocardial infarction, also known as a heart attack. Know your cardiac conduction system because it relates to your EKG waves, right? So in order, let's see if I can make this bigger. Maybe go to slideshow. Your SA node is the pacemaker, so it sets a pace around 100 beats per minute. But then we have to also take into account of the atrial filling. So your AV node is going to apply the brakes a little bit, and that's why your normal heart rate is anywhere from 60 to 100. And then it goes to the bundle of His, and then the left and right bundle branches, and then your Purkinje fibers, if you recall that order. Blood vessels, venules, arteries, arterioles. Remember, arteries are typically high pressure, thick walled, thick tunica media, and it's smooth muscle. Venules are the exact opposite, with the exception of, not with only exception, but it also has valves because it's under low pressure. And the big thing about capillaries is that the thinnest walls, and they provide gas exchange. Renin-aldosterone angiotensin system, or the RAA system. Look up that picture that I showed you guys in Anatomy and Physiology 2. And the RAA system gets activated when your blood pressure is low. Therefore, the function of the RAA system is to make high blood pressure. Look at the hormone angiotensin. Angio means blood vessel, tensin means to tense it out. And if you squeeze or tense out a blood vessel, you should increase your blood pressure. Now remember, blood pressure is also related to blood volume and the amount of salt. So more salt in the system, you're going to have more water, because remember, wherever salt goes, water goes. More water equals increased blood volume equals increased blood pressure. Also recall that the sympathetic nervous system is part of your autonomic nervous system. It's going to squeeze on your blood vessels, and it's also going to make your heart move faster. Because if you recall, sympathetic nervous system, part of your autonomic nervous system, that is your fight or flight system. Atherosclerosis or arteriosclerosis. Now, atherosclerosis means fatty plaques. So if you have a patient like me who loves beer, nachos, and Doritos of the kind, it's going to have a lot of fat that's going to get hardened over time, hence the term sclerosis. So atherosclerosis is the hardening of the arteries. And if the arteries harden, they're not pliable regarding blood pressure. So your patient won't be able to adjust. Arteriosclerosis is the arteries themselves due to damage getting hardened. But typically, arterio and atherosclerosis are used interchangeably. Women in heart disease, nice factor. Healthy weight times it's all relative, and of course, prevention of cardiovascular disease right off the bat. Diet, stress levels, because remember what controls sympathetic nervous system? It's stress. It could be congenital, that means you're born with it, or genetic. Heart failure, dysrhythmia. Remember, if the conduction system, the heart is not firing in a coordinated fashion, you're going to have decreased flow, and that's not good for blood pressure. Of course, inflammation, it's going to squeeze on everything. Remember your 5 cardinal signs and symptoms of itis. Diabetes mellitus, remember what I've always stated in class. Sugar inside the cell, beautiful. Fuel inside your fuel tank, beautiful. Fuel on your seats, glucose everywhere else other than inside the cell, inside of the cell feeding the mitochondria, is no bueno, right? Metabolic syndrome, remember all of these, if you guys remember your diabetes, nephritic syndromes and all of that, that will all affect the viscosity of blood, because what's better or easier to pump? Water. But if you're a diabetic such as myself, you are pumping molasses, so everything is more difficult. Obesity, and of course a sedentary lifestyle and stress I already mentioned. Okay, and remember, obesity is defined as a BMI greater than 30, which is the majority of this country. Warning signs or impending signs of a heart attack. And remember your differential diagnoses. They're things that look like a heart attack, but it is probably related. Chest discomfort. Many of the patients will say they feel like they can't breathe, or like there's an elephant sitting on their chest, something to that effect. Pain, discomfort, and remember, because of your dermatomes, the pain or the squeezing of the chest may radiate to the left arm and your left neck and your left jaw. Another thing about a heart attack or an AMI is the patient will describe the pain and also will have something called a feeling of impending doom. They kind of know they're in trouble. And the differential diagnosis, of course, is really bad heartburn and or GERD. It can even radiate to the back. Shortness of breath or dyspnea, of course, if your heart isn't working, your lungs won't be working. Cold sweat, nausea, lightheadedness, all of these are, the relative sign. But the feeling of impending doom, they know they're in trouble. They know this is not good, whatever it is. Now, chest pain, specifically angina, that's chest pain that is coming from, some physical activity, like mowing the lawn or carrying a couple of boxes up and down stairs. That's called angina. And typically, the patient will be given a sublingual dose of nitroglycerin. Now, if they have a history of angina and then they take their nitro and it doesn't work, then that's, along with these other signs and symptoms, that's a sign of a heart attack. Okay, and remember, pain is not a sign, it is a symptom. Okay, signs are things that we can all see. Signs are highly objective, meaning you see it, I see it, we all see it. But a symptom is how a patient feels. And again, call 911, scoop and run, move and groove. Risk factors: heredity, race, sex, and age. Remember, I stated that it's a very well-known fact in internal medicine. If I have an African-American patient, 25 to 45 years of age, male, and they even have essential hypertension, we will not perform first-line medications on these patients. It just doesn't work. So race, age, sex, these things are built-in factors. So we can't do anything about this. But what can we do? Right? We can help educate our patient to get their, to get lifestyle changes regarding their obesity. Get your cholesterol down. Remember, cholesterol is a lipoprotein that carries fat in and out. If your LDL and VLDLs are very high, that means you're carrying a lot of fat into the system. And again, comes with the lifestyle changes. They have to be changed little by little by little, not lose the 10 pounds for this month and gain back 11 next month. Diabetes, cigarette smoking, sedentary lifestyle. You got to go out. You got to go do something. Get up. Oopsies. Right? Excessive alcohol take, and of course, don't use cocaine, right? Because it is a sympathomimetic drug. So is stress. Stress is sympathomimetic, not even sympathomimetic. It's just it'll stir up. It'll increase your sympathetic nervous system. 40. Oh, geez, this is all me. These things you have to know regarding metabolic syndrome components, since you're typical American male. We're there in internal medicine. We're really big on the shape of your patient. If they're pear-shaped and their waist circumference is greater than 40 inches for well, for either male or female, it's not a good thing. Elevated triglycerides greater than 150 milligrams per deciliter. HDL should be greater than 50. If it's not, that means you got to get them on gemfibrozil or increase the cellulose in their diet, which is, whole grains and stuff like I was telling about in class, like oatmeals and stuff like that. Blood pressure, 130/85. That's already kind of high. It used to be borderline, but that's already high blood pressure. You want your fasting blood glucose less than 100 milligrams per deciliter. Actually, there are publications now that are saying 92 and 93 milligrams per deciliter. What do we go? Of course, chest X-ray, PA, lat view. You also have nuclear imaging with exercise electrocardiography. That's a stress test. They hook you up to like this Holter monitor kind of thing, which is like this semi-portable EKG thing, and they pump nuclear imaging. They pump stuff to make your your blood vessels like glow in the dark more on X-rays, so we can actually see, like how open your coronary arteries are. And remember what we mentioned about angina. That's when angina comes out when you're stressed out. So that's why they make you go on the treadmill and stuff. Echocardiography, which is it's a ultrasound for your heart. Esophagogastroscope, we scope the patient, and also remember you have your differential diagnosis of severe GERD and or severe heartburn. MRA, yeah, during my time we don't use it as much. CT, during my time we don't use this as much. Stress echocardiogram, and of course cardiac monitoring, like a 24-hour Holter monitor, where we hook up this telemetry on you and then we follow you around. Right? Stress mill Doppler, that's like an ultrasound type. Angiography, we stick a catheter in your arteries, and then we snake it all the way to go to your heart to measure pressures. We could also do contrast study, which is nuclear medicine scans, where we put a contrast material into your blood per IV, and then we do serial photographs of it. And of course, your CBC, urinalysis, you have your lipid panel or lipid profile. That means we do all the blood work regarding fats. And your SMA is a sequential multiplier analyzer. It's a series of tests that I think there's 4, 7, 13, I can't remember anymore. But it does like all the electrolytes and all these other things. Your ABI, right? Now, the arterial status of your extremities are important because remember what I mentioned about what do you call it? I mentioned about shock. When your heart isn't working very well, it will compensate rather well in the beginning, everything in your torso. But when you start getting to your fingers and toes, especially in something that is more gravity dependent, like your lower extremities, you use ABI to figure out. Now, what are claudications? If you have increased ankle pressure, brachial pressure, or maybe if you have varicose veins, you have backflow of venous blood and it starts causing pain, and cramping. Usually around the gastrocnemius area of your lower leg, you know, that big fatty, not fat, but that big belly muscle that's in your lower leg. Of course, we take the history, right? Risk factors. They should also mention here genetics. We always ask, are your mom and dad alive? If they are, what problems they have. If they are not, what did they die of? And drug use, of course, vasodilatation, right? No, it's vasoconstriction because it's sympathomimetic. Cardiac death, yeah, if you use cocaine. Methamphetamines, of course, will increase blood pressure, and that's not dilatation, that's constriction. Cigarette smoking is related to everything bad. And methamphetamine, of course, you take anything that's sympathomimetic, you're going to push the heart harder. And if there's already a blockage there, you will cause localized ischemia secondary to a myocardial infarction. And you could go through all these questions. Alrighty, that's all I got. I hope to see you guys online. I missed you guys today. All right, but at least I made a video for you. Bye.